Hello and welcome to the Ask Girl podcast, where I answer any questions that you might have during the week. And I'm especially excited to speak to Pippa Cousins today. But before we do, let me introduce the Revitalised Clinic. So the Revitalised Clinic is a multidisciplinary clinic which has helped over 8,000 people become mentally well, physically fit and pain-free. And I have here today Pippa Cousins, who I'm delighted to speak with. Pippa is an osteopath and a chronic pain specialist with lived experiences of chronic pain. And Pippa is motivated to share her expertise and lived experience with her patients who are also experiencing chronic pain. And just to show that recovery is possible, I think this is absolutely amazing. Pippa is going to be climbing the 3 tallest peaks in the UK, the 3 tallest mountains in the UK, just to show that recovery is possible. And if you would like to get in touch with Pippa after this podcast, then you can contact her by her clinic, which is called Osteopathy for All, and it's located in East Sussex. How are you doing today, Pippa?
I'm good, thank you very much.
Good to hear. So I just wanted if you could just introduce yourself to the listeners, please.
Yeah, I've been an osteopath now. I graduated in '94. Always wanted to be an osteopath. I was 12. I fell off a climbing frame and I hurt my leg, and my mum took me to an osteopath. And I decided very early on that that's what I wanted to do, and I was lucky enough to be able to achieve it. And I still love it every single day. And I think where my practice changed slightly was when actually I was diagnosed with fibromyalgia. And so that was when the chronic pain side of things kind of more came into the picture.
And could you tell us a bit more about your journey with chronic pain?
Yeah, so I think, funny enough, actually, when I talk about my story started with fatigue, not pain. The fatigue came first. The pain came a little bit later, and it was at a reasonably stressful time of my life. And I had I'd seen the doctors, and I'd been diagnosed with a vitamin D deficiency, and then I had an MRI, and I was diagnosed with degenerative discs, and eventually I got referred to the rheumatologist, and we then came up with a diagnosis of fibromyalgia. And it was kind of, as I left that appointment, I said, well, I do plan to get better. And he then said, well, then you probably will. And so my journey then took a turn when I discovered an organisation called SIRPA, the Stress Illness Recovery Practitioners Association. And I went to their conference in 2017, and it was called Chronic Pain, the Role of Emotions. And I'd always been a little bit upset that people might have been inferring that this was in my head. But actually in that conference, in that room, there were doctors, medics, all sorts of professionals who'd come in from all over the world to speak. And it was like they got it. It was like they understood it. They had the evidence to back it. They had a reason why it was happening, and they had a way forward. And it was like a light bulb moment. And in fact, interesting enough, I had a pain-free day the next day, which sometimes happens when you have these sort of revelations. Anyway, I then tried to follow the program sort of by myself, and with Georgie Oldfield's book, Chronic Pain, Your Key to Recovery. And actually, I didn't quite manage that. So I then went to see a SIRPA practitioner myself. And that was the beginning really of my pain recovery. So I was probably in pain for pretty constantly for 5-6 years. And in the midst of it, you never think you're going to get out of it. You never think there's anything that you can do. And then, as I say, this light bulb moment where you suddenly think, hang on a minute, there's an answer to this. So I used the SIRPA approach myself to recover. I would never say that I'm 100% recovered, because life happens, and there's such a big influence between stress and emotions and pain, that unless you were living kind of in a bubble in kind of cloud cookie land, I think you're never going to kind of necessarily be 100%. But I would consider myself to be 98% of the time I'm fairly pain-free. And I then went on to train as a SIRPA practitioner myself, and now I integrate the SIRPA approach, the experience that I had, and the techniques and tools and approaches that I use to get myself better with my patients in clinic.
Amazing. Just from what you've just said, I've just got a few questions I'd like just to dig a bit deeper now. I think some people find it quite interesting, but for me, I find it really interesting. So first, first of all, when you look back retrospectively at the knowledge which you have now attained as being an osteopath and being a, did you say surfer practitioner?
Yeah.
Can you ascertain, or can you think about, or can you identify what your triggers might have been at that time to predispose you to suffering from fibromyalgia?
Absolutely. And that's why when I say I almost kind of feel that I start telling my story with the fatigue, but actually that's the middle of the story. That's when the symptoms started. But when I then learned what I learned about the approach, which is to look back at all those kind of major events that have happened in your life that may have triggered your nervous system. So sometimes they're smaller traumas, sometimes they're bigger traumas. But when you look back at them, you suddenly get this whole picture. You're like, hang on a minute, no wonder my nervous system is behaving in the way that it is and producing pain, because I'd had I was at that point, I was a single parent. My son, I ended up home educating him because he really didn't get on well in school. I'd been divorced. And those, I then had to, suddenly start earning more money to support myself. So then we had to move house a few times when we didn't want to. And, there were all sorts of things kind of low, kind of more recent, in that recent few years of history. And then when you go right back, actually, with what I know now, is that actually I'm an adopted child. Now, I've had a wonderful life. I've got a fantastic family, but in my infancy, it was uncertain. And we now know that those triggering events can go back as far as very, very early life.
Yeah, there's a fantastic, but I don't know if you follow or if you read any books by Robert Sapolsky. So he wrote Why Zebras Don't Get Ulcers, which is thrown around quite a lot at the BSO or the UCO, and as well as that, a book called Behave. And what he's a biologist, I think, by training, but he looks at how biology influences our behavior. One thing he suggested quite clearly, which was supported by evidence, is that adverse childhood experiences change the way we perceive the world, and our fight-flight response becomes a bit sharper. Our limbic system is not more dominant, but it has a more significant influence on, say, our behavior and our thoughts than someone who grew up in for the quote-unquote, a more stable environment. And it's fascinating, but also shocking how so many of us are predisposed so early to the way that we perceive the world.
Well, funny enough, you shouldn't say that. One of the people who spoke at the SERPA conference in 2017 was a lady called Donna Jackson Nawazaka, and she wrote a book called Childhood Disrupted, all about the ACEs study and the results of what had happened with ACEs. And I'd been in practice 20 odd years at that point and never had heard of ACEs. And that has definitely changed the way that we work. I mean, we don't necessarily dig right into that with all our patients in their first appointment, but we have a little section now in the case history to sort of say, and is there anything that happened as far back as your childhood that was stressful? And it often opens that door. And the patients then will often say, oh, actually, yes, no, my parents divorced when I was 4, or my sister was very ill when I was young. And any of those things, like you say, that are changing and heightening the nervous system response, like you say, are predisposing us not only to pain, but to other conditions as well. But as obviously my interest is in pain. And very often I find when I then explain that really quietly to patients, that it's almost like a relief. They then kind of know why they react in the way that they react, whereas, Joe Bloggs doesn't. Somebody else, something happens to, and it's no big deal. But to them, it's like it's an enormous thing, and it raises their anxiety, and it raises their pain levels. And understanding ACEs, I think, is a really key part of the chronic pain work.
I think the metaphor or the saying know your enemy is maybe a little bit too simplistic here, or ill-placed, but still using that, do you think that by knowing your pain, or knowing the origin, or at least knowing the predispositions to your pain, has a naturally down-regulating or desensitizing effect for those individuals who are in pain?
I think certainly for me, yes, and certainly for a number of people, yes. I think there is a small trouble with that sometimes, that we can get stuck in the narrative of that. I can't be better because this happened to me, and I'm stuck in that pattern. And I think I did some of that in my own recovery. I'm like, well, this happened to me, I can't change it. Actually, if you can learn to recognize that, and learn that with the neuroplasticity we can change the way that our brains are functioning and reacting, then actually it is a huge it's a huge benefit to be able to know and understand it.
It comes back to something that you said earlier. You mentioned when you were diagnosed with fibromyalgia, I think you said something that I'm going to get better, and the consultant said, well, you probably will then.
Yeah.
Does that play much, a proactive approach, or a proactive belief, or an optimistic belief system?
Definitely. And I think by then I was starting to kind of have an idea that there might be a different way to approach it, which was possibly why I made that statement. But it was also, I think, on the back of that, he wasn't offering me anything. He said, I don't really want to give you drugs, they won't really work. He didn't offer me any sort of physical therapy, any psychological therapy, it was kind of like, we've given you this label, bye. And I think that's so much the case for so many people, and a lot of them don't even get the label. In a way, for me, the fibromyalgia label was quite important at that time, because it gave me, like, I've got a thing, I've got a thing that makes me like this, rather than I'm just in pain, tired, anxious, all the time. So it was quite useful to have the label. But I think there definitely is a spectrum of people across the chronic pain world who, there are the more proactive. There are still people who are really proactive who still can't always reach the bit that they need to unfold. And I have one patient who she's been doing this work for sort of 15 years. I think she discovered it 15 years ago, and she's been working through it. There's still a glitch. We still haven't kind of found the glitch. So that's I haven't been working with her all that time, but it's that. And then there are some people who definitely just don't want to go there, and that may be because their nervous system is so overwhelmed that actually they can't even think about changing something enormous, because that's too frightening. It's almost too overstimulating to the nervous system again. So I think I think you do have to be proactive. There's definitely a benefit if you're positive as well. Yeah, I have pain. Yeah, it's really bad. Yeah, it really annoys me, but I'm going to kind of crack on. There is definitely a benefit to that.
So part of the issue must be as well that by taking a rational perspective of pain doesn't necessarily mean that we're going to be able to quickly or initially effectively unpick the more deeper psychological or neuroanatomical connections with pain and with our sensory systems.
Yeah, completely. And I think also, interesting enough, I had an incident a couple of weeks ago where I got triggered by something, and my body just went straight back into the pattern. It wasn't consciously. I was feeling kind of cognitively, I was feeling quite okay and able, and quite, it was almost like we were having a bit of a joke about the scenario, but my body went right back in there. And essentially, as soon as your body has reacted into that anxiety pattern, the chemicals have been released, you're in it then. And I think that it is hard to, catch yourself when it's caught you unaware. Sometimes it's quite a lot of practice to keep those patterns at bay.
That dichotomy must be very I know from experience how frustrating it can be for many of the chronic pain patients that I see, and also in our mental health clinic, the patients that our counsellor will see, where logically and rationally everything is okay. However, emotionally or sensory wise, it's not okay at all. And do you have any ways or metaphors that you use to navigate your patients through that experience?
I think one of the biggest things, we talk a lot about lessening the fear and the danger. That's really important, because, you know, the pain is essentially a danger signal. So it's about, we talk about pausing. So you pause. P is for pain. A is for acknowledging the pain. You can't go, I'm not in pain, I'm going to ignore it. You've got to acknowledge that the pain's there. The U is understanding the pain. What just happened? You know, not, oh my God, I must have lifted something, but oh God, I've just got a red bill, or actually my boss is being really annoying, or I'm so tired, or whatever the understanding is of the pain. Then stop that, kind of break that cycle so you don't go into the catastrophization of it, and then exhale. So that's one tool that we give patients, is the pause, to pause. And the other thing too, and that's, I suppose, possibly quite good for us as osteopaths, is to somaticize, is to get back in the body and out of the head. So almost anything that you can do to activate your body. So we talk about havening, a havening technique, where you literally are rubbing the top of your arms, a bit like you would if you had a small child on your lap who was upset. You know, that's that natural thing to do. You can do that to yourself, essentially, to calm the nervous system down. I'm a great advocate of Qigong, you know, getting people just that really gentle movement practice with the breath. That's a really great one. We do an emotional awareness exercise where we get people to focus on the body and describe the emotion that they feel that arises from there. That's something really useful. But it's about, I think a lot of it is about getting out of the head and activating the body, walking, dancing, singing, whatever you can do to get yourself out of the pattern in the head and back into the body.
There's one interesting thing which you mentioned that I just wanted to explore. So you said that you don't want to run away from it or ignore it, and that you, in some ways, how you were describing connecting to, or advising that patient, is to actually connect with the pain, or connect with the area that is causing you pain. And I had a similar experience with a patient who was trying to use visualization techniques to essentially ignore the pain. And what we did instead is actually trying to locate the pain in her mind, or locate the pain in her body, and to focus on it and start to go towards and away, so towards and retreat. And she found that generally more desensitizing than what she was doing before. But it also is interesting because it highlights a study which I read on Tibetan monks. So Tibetan monks, or the Association of Tibetan Monks with Pain, the most well-known example to a lot of people is the Burning Man. So the Tibetan monk who sat down in protest and set himself on, or who was set on fire, and didn't move from his meditative position. Now, the research shows that the Tibetan monks will experience pain more vividly. However, they will, because they're focusing on it. However, they experience it as the observer, not as being in it. So almost the equivalent of, rather than being in a burning building, looking at a burning building on an HD TV or something like that. Why? So it might be there might not be enough data out there to explain why, but is there any idea or any theory as to why that is? Why going into it or observing it is more therapeutic than ignoring it?
I don't know. Certainly with the work that we do, the sort of somatic experiencing of it in that sense is, for us, a lot of that is attaching the emotion to it, and actually then so rather than just the sensation, it's about the emotion of it. And I think that often is tied in with whatever the triggering event is, or the actually priming event was, which often can be much earlier. So the triggering event might be what happened now, but the priming event's earlier. So certainly when we look at that, we're looking to try and associate the emotion with the pain, if that makes sense. I'm just trying to think if another technique that I do use with patients is I think sometimes when we feel all consumed by our pain, we feel like we are in pain, like you say, we're in that pain. And I describe a scenario where I say, well, hang on a minute, maybe not all of you's in pain. So is there part of you that can be the grown-up, if that makes sense? Because often pain and experiencing pain is quite a childlike thing, and quite we feel kind of quite victim in that, and we feel quite oppressed. Whereas if you can find a sort of the part of you, and a huge number of my patients are women, and a huge number of them are parents. And it's that thing of saying, you know, I know on that day where you don't really want to go and see your child's head teacher, but you'd pull your socks up and you'd get off and you'd go off and you'd go and deal with that situation because you know you have to, even though you don't feel you want to. So I sometimes get to people, I say, can you find that in yourself, that part of you, to then encourage, support, nurture the bit of you that's in pain. So it's almost like you parent yourself. So it's a self-parenting. We teach people almost to sort of self-parent themselves with regards to their pain. So they're taking the stronger part of themselves to, look after the part that needs the nurture, and almost ask it, what do you need? What's going on? What's the problem? Kind of have a conversation with yourself about it to see what it is that's coming up.
And just out of interest, because a lot of people would feel that pain is more somatic, so more related to the body, but when asking the pain, or when asking yourself, what do you need, do you often have the patients express that what they need is something more emotional, or something more to do with their home situation, or to do, right? That's the case, is it?
Very often, I think so when we talk to people about pain and talking about that sort of somatic, whether it's a neural pathway pain or whether it is an injury type thing, one of the big things is that, pain that, and I'm sure you know this, but it's that pain that moves. So it's not in one static place, pain that varies, pain that's not always there. So it's there sometimes really badly, but then the next day it's not there. Pain often, interesting enough, that's decreased when there is a distraction. So when, people are out, I went out for the day and I was absolutely fine, and then I was at home yesterday and the pain was really bad. Pain that doesn't follow a specific anatomical structure. So it's definitely not, like you say, specifically in the knee, doesn't follow a neural, a nerve route, like a dermatome or distribution. It doesn't follow that. So, or it's bilateral. There's very little pain that should be bilateral if it's caused by tissue damage. So that's one of the things that we explain to people. And then, as I say, then when we've kind of ruled that out and they've started to not worry about that they've hurt this or done that or damaged this, then it is very much about looking at that. What was the trigger? What is the other thing that's going on in life at that time? And it's fascinating what comes up. Absolutely fascinating. You can't always predict it. I had a patient once who we'd seen her a few times. She'd got a little bit of a scoliotic pattern. We'd been treating her for that. She'd had pain for, I can't remember exactly, but it was maybe 6 or 12 months. She'd had it for it was longer than that, initial tissue injury. It was over 3 months certainly. And she came in and we treated her, and then it was just not quite getting better. And so my colleague had asked me to come in and see her, and we'd come in to see her. And this is slightly shocking, just to pre-warn people. And I said, listen, I'm a little bit like a terrier. I said, I'm really sorry, I'm going to ask you some slightly odd questions. They might seem a bit off the wall. Always feel free not to answer them. That's something that we always do. I said to her, what was going on when you had this pain? Well, I lifted this box. I said, oh, okay, was there anything else going on at that time? Had you got to move house? Was there anything stressful? Was there anything going on in your relationship? Anything that particularly could have triggered it? And she just said, and this is the shocking bit, she said, I was out walking my dog one day, she said, and I found a man hanging in the woods. And literally, we spoke about it. She had fantastic counselling, but had never put the two things, she'd never put that trauma of that event, the effect it had had on her nervous system and her pain in the same box. They'd never been associated. So we treated her. It relaxed as it had always done in the treatment, but we spoke about this and we spoke about the nervous system while we were treating her. And then she came back, I think, one more time, and then the pain had gone. But it is that, it just that sometimes, as I say, I am a bit like a terrier. Dig, 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 go at it, a little dig, 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 and sometimes it's not. Sometimes it does come back to a physical thing, but one has to be careful of bias. When I, I'm always looking for that little emotional nugget, and sometimes it is, sometimes there's a fallen arch, and you have got to look at that. And we treat hands-on all the time, because you are feeling that with your hands, you're feeling the tissues, you're feeling the response in the tissues. And that's the beauty of this, is when somebody then describes an event and you sit and think, nah, that's not making enough difference under my fingers. And then this is not, this is my, my according to Pippa, not necessarily according to the rules or the the studies or whatever. But the most amazing thing is when they then latch onto the thing that's important, the tissues change under your hands, without you necessarily actively doing anything. With you just listening, with your palpating with your fingers, there's just this change in the tissues when they get to the bit that's important. I love that.
There was one thing which you mentioned, trying to find that emotional nugget. There's a quote by Sigmund Freud, and he said that when the conscious, and it's because I think he came from a medical background, but he said that when the conscious mind shines light on the unconscious lesion, that the unconscious can amend itself, or it can essentially fix itself. And that's what I found very, very interesting, that when I'm having these naturally cathartic, natural conversations, inquisitive conversations with my patients, and it tends to go down a more emotional route, just them understanding or just them highlighting the link can be everything that they need. And I'm getting ready to implement certain CBT techniques, certain motivational interviewing techniques, and I don't end up not actually needing to use them at all, because they're able to then figure it out themselves.
It's magic, that moment, isn't it? It's like that. It is absolutely magic. And there's, I have a box of tissues to hand all the time. I make my patients cry on a regular basis. But it is that moment, and you can see the light come on behind their eyes, and that realization of like, oh my God. And also I think one of the biggest things is that, oh, it's not actually my fault. It's suddenly that, something happened to me, and that means that this isn't because I'm a bad person or because I'm not trying hard enough or striving or whatever, which often comes with the pattern anyway. But it's that moment of, like you say, and often it's like you've unlocked the door, and then there's this massive change within the system. Everything calms down, and then you can start, like you say, sometimes then it's that they can really start to teach their body how to change. And that's when we will give all the techniques that we have kind of in our toolkit, but then they start to work. But until you almost have identified the bit that's locked it up, it's difficult to, sometimes difficult to proceed.
And I can imagine that for a lot of people, when they're trying to overcome chronic pain, including yourself, and when you've successfully done so, it can be, and this is from my experience with patients, is that sometimes they're under the misconception that if their pain returns, or if their pain is able to return, that they never actually truly conquered it in the first place, which is quite a misconception, right? Because trying to unwind these very deep, a lot of the time very old neurological connections, is like trying to remove the ingredients from a cooked cake. It takes a lot of time, it takes effort, but also, as well as that, I think sometimes people misunderstand that it also takes maintenance, and also takes having assets in your routine and your lifestyle that maintain your progress. So what I was curious of is what do you do to maintain your progress?
So funny enough, I describe it to patients, my sort of metaphor for that is, it's like growing a seed, and the process of pain recovery is a bit like, so we start off and we make a bit of a mess. We've got to get the weeds out the ground, and we've got to scratch the ground out, and then we plant a seed, and then we water that seed. And often at that point, it's really exciting, and the plant comes up and it's all going. If we forget to water that plant, it's going to wilt again later on. So it's like that. It is about we often talk to our patients about 15 minutes a day. Just find 15 minutes a day for that activity that calms your nervous system. That might be a walk with a friend. It might be a cup of coffee sitting in the sunshine in the garden. It might be meditation. It might be journaling. It might be Tai Chi. So for personally, journaling, expressive writing has been a hugely important part of my recovery. I think the reason being is that often we get stuck in a narrative that goes round and round and round. And actually, when you write it, when you put it on paper, you get beyond the first level of the story that I'm telling myself. You get to the bit that's underneath that, and you suddenly go, oh my God, no wonder that's triggering me, because it's related to something else. So journaling is certainly a first port of call for me. I love walking. Getting outside, moving is really often, if I'm really agitated or uncomfortable, actually I can, if I walk, by the time I'm about 20 minutes in, I usually start to feel quite a lot better. The Qigong, Tai Chi, again, really, that was what I started with when I couldn't swim, I couldn't go to the gym, I couldn't do anything else, I was too uncomfortable, actually couldn't even walk at that point. Tai Chi was really great, that really gentle moving type meditation. Meditation, I do a lot of meditating, not for extensive periods of time, but 15 minutes here, 15 minutes there, and I'll pick one that suits what I need at that time. Do I need to reduce my anxiety? Do I need to calm my nervous system? Do I need to be kind to myself? Whatever it is. And I suppose one of the biggest things I've learned to do in the process is listen to myself, my body, what my body needs. I'm a great striver, I'm a great pusher, I'm a great one. I'll go, on to the next project and the next thing and the next thing. And actually, sometimes your body's just going, excuse me, could you just stop for a bit, So I think those definitely, meditation, journaling, gentle movement are really, really great ones that, I do all the time. So
amazing. Pippa, I've got to thank you so much for your time today, and I was wondering if there's anything else that you wanted to share with anyone who might listen to this podcast.
I suppose the reason I love talking about it in some respects is, well, two things. One, from an osteopathic perspective, I so want all the osteopaths to know about this extra bit. Osteopaths are epic. Osteopathic medicine, the osteopathic approach, I think, is just brilliant. I'm like a stick of rock. If you break me, I say osteopath the whole way through. I'm completely with osteopathy and I'm completely with that hands-on. But adding that psychologically informed, trauma-informed knowledge has made such a difference to our practice and to our patients. And it's amazing. So that's why I talk about it. And I also talk about it from the patient's perspective, because I want people to have hope. There's so many people out there in chronic pain who've not ever heard of this kind of mind-body work, and essentially they don't know, and they think they've got this diagnosis and they're stuck with it for life, and that's just so sad. And so that's why I just really like to kind of bring it to the world to help other people. So
I have to echo exactly what you've said, Pippa. When it comes for me as an osteopath, after graduation, it was when I started to combine, I would say, evidence-based osteopathy, or looking at evidence-based osteopathy through a truly holistic lens. So actually understanding that the fact that we separate the bio, the psycho, and the social is only really for our own understanding and our own ways to learn about the body, about the mind, because it's easier for us to compartmentalize it. But when we actually truly look at how these systems are seriously integrated with each other, that it's an impossible line to cut between the systems, and making sure that the patient is guiding the journey and the patient is the hero of the story rather than the practitioner being the hero of the story. It was game changing. And yeah, I'd 100% echo that the psychological component of what we do is massive, and it's something that should be respected as much as possible and integrated as much as possible.
I think, interesting enough, I think osteopaths actually do it pretty well, even if they don't know that they're doing it, because we are so blessed to spend more time with our patients and get to know them. I do think osteopaths, and like our history coming from Andrew Taylor Still, we are like old-fashioned family doctors in some respects, that we sit and listen to the patient's story, and very often we perhaps know their grandparents or their aunt or their children. And I think osteopathy hands-on works amazingly well, but I think it's because the patient feels heard. And when you then start to inform that hearing, that what you're asked, what you hear, and therefore what you ask, I think it's like it gets better exponentially. It's amazing.
Completely. And this is within our principles as well, right? Andrew Taylor Still said the body is a unit of mind, body, and spirit, and that we have our own capacity to self-heal. And that goes beyond the anatomical 100% of the time. Pippa,
and what I love that the evidence is now catching up with that too. Exactly. That's what's so amazing, so amazing.
Exactly, 100%. I've had such an enjoyable experience talking to you today. Thank you so much for your time. I've learned a lot. And yes, what I'm going to do is post a link to your website, and I take it people can contact you via your website and via the details on your website. So if anyone is in chronic pain and would like to visit Pippa, you know what to do. You need to go to, is it osteopathy for all.co.uk? Yeah.
Osteopathyforall.co.uk, and we're in East Sussex.
Amazing. Thank you so much for your time, Pippa.
It's a pleasure.